Basic care and comfort. The nurse teaches the client to avoid which foods? Now, we try not to use the word avoid in questions, but when you're teaching somebody about foods, that's actually one of the positive actions that we take, is teaching them what to avoid rather than just what to include. So, you want to make your patient, let's make them have Coumadin therapy. Do they need to avoid anything?
Well, they need to have a consistent amount of greens.
They have to have consistent greens. Is there anything they have to avoid? What if I give them atrial fibrillation and Coumadin? Now what do they need to avoid? Do you want them drinking caffeine?
No.
So just with that little tweak, really the main dietary concern might just be caffeine. Because there's not many food groups that we're just going to have somebody avoid. That would be pretty rare. Now, we can have them avoid certain foods, of course. So what if this person, somebody throw me a condition.
COPD.
All right, you've got somebody with COPD. What kinds of foods do you want them to limit or avoid?
Carbs.
High carbs. Now, does that mean they can't have any carbs?
Mm-hmm.
No. So how are you going to teach them what that means? What does low carb mean to most people?
No bread.
You think that's what it means? You think they think that's what that means?
Probably not.
You don't know.
They mean like
You gotta ask. You've got to ask. So you're going to tell them to limit maybe their total intake to, say, I don't know, 60 grams of carbohydrate a day, space it out, don't have it all in one meal, those kind of things. We wrote another test question. After evaluation of, let's go with a port-a-cath infusion site, so an implanted port. Which action does the nurse perform next? So what kind of site complication could we have with a port?
It could clot off.
All right, so we've evaluated it and it won't flush. So that's our complication, is it won't flush. What's our first action?
What are we flushing with? Heparin?
Yep.
So we're trying to flush the port-a-cath with heparin and it's not working. What do we do now?
Call the doc.
Call the
Are you sure? See if you can get an order for an x-ray, maybe?
There's actually a couple of steps you can do for this one first.
So like have the patient reposition sometimes?
Because of where a port-a-cath is and because of how they are, because they're implanted, they're under the skin, they are prone to getting not malpositioned, but differently positioned. So sometimes it's a matter of having them raise up their arm, move their arm this way, roll to the side. Those are some of the things that you can actually do first. And you try to flush again. Okay, still not working. What's next? I know what. We'll take a vote group on the unit about what they think's wrong with it. Gather up in the nurse's station. Let's see. What do y'all think?
If it won't flush.
I think somebody said it clotted off.
That is a good question. Let's make it a new graduate nurse.
I'm gonna go get a more seasoned nurse and have them
See if you
try.
can find somebody that's a little bit more seasoned that knows things about making people stand on their head and do jumping jacks in order to get their port-a-cath to work. Because if you've seen more than a few, you know that they're not always so straightforward. So that might be the next thing. And then we can move towards things like calling the provider and requesting a study for the port to make sure it's not clotted off. We might do just a small dose of TPA in the port first. Some places where they do port-a-caths really often, that's the first thing that you'll do. You'll put just a little bit of TPA into the line, and that'll eat the clot, and then you can go on about your merry way.